When I was first training, we didn't have to have the discussions about intraocular lenses that we do today. When you have cataract surgery, we actually are removing your eye's natural lens and we're replacing it with an intraocular lens that is made, and there's a lot of different types that are manufactured. Today, more than ever, and probably even more in the future, there's going to have to be a discussion and understanding amongst the doctor and the patients about which lens they're getting into their eyes, because it's a big deal. It's how you're going to see for the rest of your life. In today's science, a lot of it is focused, pardon the pun, a lot of it is, in today's modern cataract surgery, a lot of the lens choices have to do with how you're going to see afterward in terms of wearing glasses. So when you get a new lens, what our hope is, even if you started wearing glasses when you were in second grade and you were super nearsighted, we can actually put a new lens in your eye that can make it so that you no longer have to wear those thick glasses. People love it. People love those glasses, or the surgery for that reason, because in addition to seeing better, they see better without these glasses that they have to wear their whole time. A lot of times folks are older, they're getting more contact lens intolerant because their eyes are drier, so they're having to wear their glasses, they can't wear contacts, and now all of a sudden we're able to free them of that burden. They can wake up, they don't have to reach for their glasses first thing. In fact, I have a lot of patients in their post-ops visits who say, I still wake up in the morning and the first thing I do is reach on my bedside table for my glasses, but I just realized I'm not wearing them and I don't need them. So a lot of it has to do with not having to wear glasses. We're really, really good at that. We're really good at hitting our target for you not having to wear glasses to see distance. What the sort of, the ideal situation, and what a lot of these new technologies are trying to move toward is not only being able to see distance, but also not having to wear reading glasses. So a lot of people, as you get older, you can see fine in the distance, but when you go to read, you have to wear the reading glasses. That's a little bit trickier. We don't have yet, even in 2025, an ideal way to make that work that you can see near and far with no glasses. So the various lenses that we have do employ some physics and of optics to try and help you get some depth of field without having to grab those reading glasses as often. So we have something called multifocal lenses, extended depth of field lenses, and then we have which is what I tend to do, my favorite, is just do a little bit of what's called monovision. So these are all tips and tricks to try and get you to be able to see near and far. All of them have some compromises, and I try to tell patients that, and I try and tell them there's no way you're never ever going to ever need to pick up a pair of glasses again. That's just not realistic. So we go over these various types of lenses. Personally, my favorite is to offset the two a little bit, let them accept and understand that they're going to need to use some reading glasses. The multifocal lenses are great. The extended depth of focus lenses are great. But in order to get that effect of not having to wear glasses as often, it does decrease the quality slightly. So for me personally, I'm all about the quality of vision. So I go for the lenses that give the best quality, even if you have to grab those readers a little more often. Try to offset them a little bit so that people can have, when they have both eyes open, that they can, not have to, they can drive and still see their dashboard. But if they're going to be reading a book in bed, they're going to have to wear some reading glasses.